Well, welcome everybody to the New Teeth Now webinar. My name's Bianca and I'm here virtually with Dr. Kirkpatrick. And tonight we're going to talk all about dental implants and what New Teeth Now has to offer. And we'll kind of just get right into things. So take it away, Dr. K.
Okay. All right. Well, thank you guys for being on here. Bianca, thank you for joining us virtually. With hopefully the COVID stuff will get better pretty soon. But right now, I still feel like that it's appropriate to do this virtually since we have the technology to do so. So tonight we are going to talk all about implants. Kind of brief little introduction about me. I'm originally from Kentucky. Did all my school at the University of Kentucky, and then did surgery at University of Florida in Jacksonville. And one of the most important things you're going to hear tonight is that I am a board certified oral and maxillofacial surgeon. And that is very important whether you choose to come here and see me or you choose to go somewhere else. Make sure that whoever is treating you is a board certified oral surgeon. There's a lot of people that do this that are not, and that's kind of how we hold ourselves accountable and make sure everybody's up to the same level of knowledge and treatment. So I'm going to show you a brief little video of kind of what we're going through at our office and how we're keeping our patients safe through the pandemic. And it's kind of a cool little presentation, so I'm going to go over this now. Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Now's the time to get the smile you've always wanted. Call to learn about our specials and visit newteethnow.com.
Okay, so that was one of the commercials that we ran when we were allowed to reopen with a lot of the elective procedures. And I feel that's important for patients to know that we do everything that we can and everything that we know just to make sure that everything's clean, that everybody's protected. So A, we can stay open as a business, and B, we can make sure that our staff and our patients and our families that we come home to are protected. So with dental implants, they are recommended by our National Association as the best way to replace missing teeth. And for those of you that do not know what an implant is, it's actually this silver structure here. It looks like a screw, and what it does is it replaces the root of the tooth. So it's not the entire tooth, and there's a lot of kind of misconceptions about like, oh, I need an implant, or I'm going to get an implant, and you think that the implant is the tooth. Well, the implant is just the foundation or the support system that allows us to put on these full arch bridges, or your general dentist to put on a single crown to replace the tooth. But once the implant, once you've lost a tooth, the implant goes into the bone, and that's the foundation that everything gets attached to. How we do our New Teeth Now procedure, this is showing an upper jaw, and typically do 6 implants in the upper jaw, 4 to 6 implants in the lower, and that's how we can secure the one big bridge that replaces everything in one jaw on 6 implants. The lower, this is showing the 4 implants, and most of the time, people don't have either enough bone or they don't even need a 5th or 6th implant because these reach around all the way to the back molars. So we'll show you quite a few before and after pictures tonight. And I think it's important for you guys to know that these are all my personal patients that I've treated. They're not out of a magazine or a website or borrowed from another surgeon. These are real patients that with their real before and their real after pictures. And I think they do a really good job at showing what we can accomplish with the New Teeth Now procedure. And just as a little side note, I'll talk about it later, but all of these procedures, they're done, when you see these before and after pictures, it's in a day. So one of my patients, well, a lot of my patients are pretty special to me and my staff and the rest of the people at the office. But Gloria is one of those, and she had a pretty unique story where she was involved in a car wreck when she was a lot younger, and it broke off a lot of her upper front teeth. Her dentist at the time had made this kind of makeshift partial denture that went in, snapped on. She removed it at night, but what it did is just cover up and was a way that she could have teeth when she smiled. She couldn't really eat very well with it. And he actually left, if you look at her picture, he left the roots in place. So you can see the little roots at her gum level there. She wasn't really happy with that idea that he left those roots there, but he actually did her a huge favor, because when the roots are there, the bone still maintained a lot of volume, which I could use for the implants. And Gloria is going to share with you just her story and what she went through here at our New Teeth Now office and the New Teeth Now procedure.
The car accident I had was tragic. I lost everything, just all down to nothing, like gums. And after that, I went to a dentist and I got a plate just to fit up there. And then I would use adhesive to hold the upper plate to keep it in place. And I would have to do that like every 2 to 3 hours. Go in the bathroom, put my adhesive on, and sort of stay up there to keep it from... It fell out a couple of times, but I was like surprisingly hit it, and just kept my mouth closed. I spent a year looking for a dentist that would do what I really needed done and right now. And I found Dr. Kirkpatrick. So then I came over at 7 o'clock in the morning, and about 4 o'clock, I was going home and I had teeth. And I'm like, oh my God. Now I'm able to chew my food. I'm able to taste my food. I'm able to swallow my food and smile. I can smile as big and pretty as I want to. And I thank Dr. Kirkpatrick for making that happen.
So here is her before and after picture. And that's a pretty big difference between how she presented when she came to see me originally, and what she ended up with her final teeth. So we also treat couples, and Lori and Tom are a couple that came to see us, and she went through the procedure, he went through the procedure, and I think we have a video of them, but they had a really cool story. And it was interesting to see them go through this process together.
I can't thank New Teeth Now enough for giving me this smile and the confidence, and it's just a wonderful thing.
We would have fallen in love anyway, but having our new teeth makes it easier to be in love with each other. We met about 30 some odd years ago, 35, 36 years ago. Lori was working in a restaurant. I would stop there a lot of times for something to eat. And that's how we got to know each other. I remembered noticing her from when we first met, that she had a beautiful smile. We just started talking and hit it off as friends. I knew that she had a boyfriend at the time, and I was married at the time. Then we wouldn't see each other for another few months or talk to each other for another few months.
We pretty much had lost touch when I moved to Florida.
I had very poor teeth all my life. Primarily it was because when I was very young, I was sick and was given a lot of antibiotics, which affected the enamel in my teeth. So lifelong bad teeth.
I had bridges and caps and crowns and root canals and a whole life full of those things. And I had a nice smile. My teeth were nice, but then one broke. I felt inhibited now. I felt like I couldn't smile anymore. So I'd seen the commercial for New Teeth Now on TV, and I was like, wow, they can really do that. I'd love to have that done. Tom sent a poke to me on Facebook. So I then sent him a poke, and I said, I see your poke and raise you a wave. Tom had asked me to go to a barbecue with him, so we went to the barbecue together and we were having a good time.
Then at the barbecue, one of the things that came up was that Lori had mentioned to me that she was having this dental work done.
When I said to him, Well, you're not doing anything. You're retired. You can fly. I'll fly you down, and then you could take me.
Even then, seeing her after she had the teeth done, I knew that, wow, that's what I need to do. I knew I had a lot worse of a situation going on. At that point, literally, I was down to 7 teeth.
It affected the way he looked, the way he felt about himself, definitely the way he ate. It was a beautiful thing when he decided to get his done too. I was happier for him getting his done than I was for me.
At New Teeth Now, we can place a full set of beautiful, functional, implant-supported teeth in one day. And it's amazing to witness the look of relief and the joy on the faces of our patients. We love what we do, and we're grateful to be able to do it.
Everybody we've ever met, from Phyllis at the reception desk through all the girls and all the doctors, they just make you feel very comfortable, and it's a positive experience from beginning to end. It really is. Now we just look at each other and smile, and
Yes.
we're amazed, and we fall in love every time we see each other smile. It affects every facet of your life. And we began to feel adventurous, like, you know, young and in love and just wanting to go out and share the world together.
They look beautiful. You look more confident. You're happier. You're talking more.
We can eat anything we want. You don't have to chop things up into tiny little bits
Right.
anymore. And you're left with an absolutely gorgeous smile for many years to come. We just match in every way. And now we're a teeth match too.
All right, that is, you know, I like their story a lot, especially when she says, you know, it's just one of those parts of her life that she doesn't have to think about anymore. And I think teeth do really affect people on a day-to-day basis, not just with, you know, what the appearance is with some people, but just how they can chew and chew without pain and not think about what they're eating, or can I eat that because I have dentures, or I've got no teeth and I can't really chew that. And always having to order something soft at a restaurant. I had a patient tell me that the other day, that he couldn't wait to get out and just go, when everybody else is ordering a steak, he wants a steak. And he's like, I haven't been able to do that in about 5 years. He said, I always have to order something soft, like I always have to get the fish, which, you know, fish is a pretty good thing to order, but when everybody else is getting a steak and he wants a steak and he can't because he can't chew it, then, you know, that starts to really hit home and affect people. So why do people do our New Teeth Now procedure? Number one should be to restore your total body health. I'm going to talk about relationship with periodontal disease a little bit, but, you know, it really does affect your entire body and the overall health of your body and all your organ systems. Definitely improves self-confidence. You could tell that with Lori and Tom's video. Helps you bring out a smile, improves your ability to eat. One of the big things that we hear a lot are people have kind of neglected their oral health. That's because they're scared of the dentist. And the one cool thing about this procedure is we have a really good anesthesia team, and you're asleep during the entire procedure. So you come in as you are, you go to sleep. We do what we need to do with the surgical procedure, whether it's take teeth out, or if you don't have teeth, we put the implants in, and you wake up and you're finished. And then the postoperative pain level definitely will surprise you, because it surprises us. It's very common for patients to tell me that, well, you know, you gave me some Percocet or a narcotic, and I took one the night of the procedure because I was scared it was going to hurt, but it never really did, and it was something the Advil could control. So they take one pain pill and then, you know, treat the rest, you know, the next 2 or 3 days with just Advil or Tylenol. So the oral body connection, you know, one of my favorite quotes is, the mouth is the gateway to a pretty awesome creation. And I kind of came up with that because if you think about it, the mouth is the very first thing that encounters the air you breathe, the food you eat, which are the two basic things that keep you alive. So, you know, if you're chewing food in a mouthful of periodontal disease, I mean, think about that. You chew the food and bacteria, you swallow the food and the bacteria go down into your stomach, gets into your GI system, So it can definitely, exacerbate some digestive diseases. When you breathe in, you start laughing and you breathe in real heavy or taking big deep breaths, you're running or exercising, and some of the bacteria gets into your lungs. So it exacerbates COPD, asthma, a lot of the other respiratory diseases. Now with COVID, we have no idea how periodontal disease and that low-grade chronic infection is going to affect people that have had COVID. There actually is a study that I was reading about yesterday that is looking at people with periodontal disease have a 10-time more chance of having a bad outcome with COVID than if you don't. That's pretty impressive, 10 times. Now, whether that is truly related or not, that's, we'll find out. But, that was what they were looking at with their study. Definitely is related to the cardiovascular system and can increase your chance of having a heart attack, osteoporosis, stroke, and diabetes. But what it really boils down to is it's a low-grade chronic infection. And the longer your body's fighting any type of infection, whether it's an infection in your, a sore from a spider bite on your leg to the periodontal disease in your mouth, the longer your body's fighting that, it will reduce the effectiveness of your immune system and can shorten your life expectancy. And that is how it can start to affect and change your life. What is periodontal disease? Well, this is it, this picture on the left. And this is not a really severe case, but if you look, you can see recession, a lot of gum recession. So the gum has shrank away around from the teeth. And that's because periodontal disease has caused bone loss. So when the bone shrinks, the gum will follow, and you'll start to see, here's the crown of the tooth, and this darker yellow brownish stuff, that's the root. You're not supposed to be able to see the root. It's very sensitive to sugars, to cold drinks, hot foods. So it can hurt when you're chewing your food. It can hurt when you breathe in if you live in an area where the temperatures do get pretty cold. And that's just a low-grade infection that this person's body is constantly fighting. And this is what I did. This is the same day, actually, before he even woke up. This is what he looked like. So I took out all the teeth, cleaned all the periodontal disease out, put in these 6 implants on the top, and then closed everything. All these little strings, those are the stitches. But if you look, the gums from right then, at that moment in time for this patient, the slate has been wiped clean. He's starting over with healthy gum tissue, healthy bone, and with no periodontal disease, no infection. This is what he looked like a couple weeks later. You can see good, healthy pink gum tissue around all those little connectors that are on the implants. And those connectors are what the teeth get hooked up to. And this is his, before and after picture. He even changed his hairdo. He lost his man bun. But if you look, that's a pretty big change for this guy. From missing a tooth that he had a little flipper that was like a little retainer that would snap in and out, to, his teeth were not perfectly lined up, to a really, really nice smile that not only looks good, but he can eat anything he wants. So if you want to be truly healthy, you must restore your oral health. Gone are the days where your primary care doctors, when you go in for a physical, they're just going to take the little popsicle stick and stick it in your mouth and tell you to say, ah. They're really, well, at least they should be, really looking around, making sure that your gums are not really red, swollen, bleeding, because if they see that, they're going to highly recommend that you get in to see a dentist to get that taken care of, because they know, and now that, because there's a lot of studies and there's continuous studies on this, where it does affect your body, and they need to be thinking about that. The mouth is actually part of your body. So who's a candidate for this procedure? Well, a no-brainer. If you have no teeth or you're unhappy with your dentures, you're a candidate. But if you have a mouthful of bad teeth, you have severe periodontal disease, especially if you've ever been told that you don't have enough bone for dental implants, you need to come see me. I have yet to have a patient that I couldn't do this procedure on because they didn't have enough bone for implants. I've been here since June of 2007, and we do one of these not every day, but almost every day. And I have not had a patient yet that I couldn't do this on because of not enough bone. But saying that, I've had several patients almost weekly tell me that, well, you know, I'm here, I saw your commercial, you said that you could treat patients who didn't have a lot of bone. I've already been to 2 or 3 other people, and they tell me I didn't have enough bone for implants. I'm not a candidate, so I'm just here for one last shot. And then I walk in the room and tell them that, oh, you got plenty of bone for implants. We can do this. So there's a lot of techniques that we use to help patients who don't have a lot of bone, but definitely we can help you. Another one of my patients, and you know, if you look at his before picture, he's got that little black dot is a draining infection that's coming from this tooth through the bone, through the gum, draining into his mouth, missing teeth, crooked teeth, crowded teeth. Just, he had a lot going on, and you know, he'd always thought about doing something with his mouth and trying to get, you know, his oral health taken care of, but he just never did. He prolonged it until eventually he got into a situation to where he was having a lot of discomfort and he really had to do something. So he made the decision to come see me, and that's what he ended up with. I think he looks spectacular. It's a huge difference between his before and afters. And, you know, he had a really good outgoing personality, even with his before, but you could totally see it change him. You know, every time he used to come to see us, he would always have, you know, matching hat and shirt. He always wore a hat. He was in the theater or waiting room telling everybody about his procedure and kind of wanting to show his teeth off. It was just a really cool transformation that we got to be a part of in his life. And by the way, just, you know, if you look at his teeth, like, they're perfect. And they look that way because that's what he picked. You get to pick out what you want these to look like. Not everybody wants their teeth to look like that. Some people want them natural. Some people want a space in between the 2 front teeth. Some people, because that's what they've had. Some people want them to have a lot of character to them. They don't want them to look perfect. They want people to know we've even done the procedure. They just want to be healthy. So that's a really cool thing about this is everything is custom for every patient. So you play a big part in what your teeth look like. Another lady, before and after, her teeth on the before picture, you know, yeah, they're maybe little stained, but that's a denture. So she didn't have any teeth. She had a denture. She was tired of having something that she had to take out and put on her nightstand, you know, when she went to bed, and the next morning rinse it off and stick it back in her mouth and use a lot of adhesives to try to get the thing to stick. She wanted something that never came in and out, that she could brush like regular teeth and eat what she wanted. And that's her after picture with her, we call it a hybrid bridge because it's a full bridge on implants, but that's her after with her hybrid bridge in. This lady, she's in this presentation because if you look at her before picture, she's been missing teeth for years. For decades, she's been wearing dentures. And she had even like a couple implants placed by another doctor that she had this lower denture that would snap on these. And it helped stabilize the denture and helped her keep it in place, because the lower denture, I've never met a patient that was ever happy with the lower denture. They move around, they rock, there's no suction. You have to use a ton of adhesive and you still can't bite into anything that you want to. But the implants do help. So they started to fail. She had seen multiple doctors and oral surgeons that told her she didn't have enough bone in her upper jaw to get implants. And she didn't. She had hardly any bone, but she had enough. And especially with the Zygomatic implants that we can do. And here's what we did. She came in with that denture. She left with those screwed in bridges, and that's her after with these Zygomatic implants. So what they do is they bypass in people who in the upper jaw don't have enough bone and would need traditionally really big bone grafts and sinus procedures. Now we can totally bypass that. You don't have to have the bone grafts. We can anchor these into the lower part of your zygoma, which is your cheekbone. And that's how we're able to stabilize and secure these bridges. The recovery, pretty much the same. It's just they bypass where you don't have bone and use the bone you do have. Another lady flew in from out of state because she knew she needed zygomatic implants. She couldn't find anybody in the Northeast that she was comfortable with placing these. So she came to see me. That's her before picture. These are all failing. It's one big bridge that you could literally take your fingers, grab it, and move it up and down. It was loose. So she came in. That's her after screwed in bridge on zygomatic implants in the back part of her upper jaw. You can see them here. They're longer. They go in a really weird direction when you are used to seeing what a regular implant would look like these. So I put in 4 traditional implants, 2 in the front, 2 in the middle, and then the zygomatic implants, 1 on each side in the back. And that enabled her to get that screwed in, secured, and it's rock solid. This patient of mine who literally had no bone. So we did what's called a quad zygomatic implant procedure, where you put 4 zygomatic implants, 2 on each side, and always try to find anything that I can in the front to get, just because I'll try to put in as many implants as I can in somebody, whether it's, a quad zygomatic implant case, I'll still try to find 1 or 2 in the front if I can do that. And with this patient, I was able to do that. And that's just, it helps increase the stability of everything. So Mary, another one of our patients who, she's actually a nurse and knew she needed this procedure done for quite some time. And it was really, really cool to be a part of her transformation and watch her go through the process of our new teeth nail procedure.
People, sometimes they think that I'm upset at them or that I'm unfriendly just because I don't show my teeth. So I don't have a big smile because of that. A lot of the other dentists told me that I need a bone graft, and because of that, I was going to take some time to do it. But when I met with Dr. Kirkpatrick, he just said that he can do it. I'm scared to death, okay? All those things just go through your mind. But I know that Dr. Kirkpatrick will do me right. It's been 2.5 months since I had my surgery, and I feel great. I didn't have any pain. I have beautiful teeth. Not only I'm saying that, but people surrounding me saying that. It is wonderful. I like the person that I'm looking at in the mirror. I made a decision this year that I was going to change my life, that I was going to do things for the better. And then one day I was in the lunchroom and I saw a commercial from New Teeth Now, and I decided to make a call. Dr. Kirkpatrick and New Teeth Now told me it would be just one day and I will feel no pain. I didn't believe him at first. You crazy? You're going to pull all that? And it's not going to hurt. Nothing's going to happen. So I told him that I had one more dentist to ask. My dentist, his answer was, you're better off going with him. So I called Dr. Kirkpatrick, I made the appointment, and on June 22nd, I have it done. The day of the surgery, I got there about 7:30, and I was very anxious and nervous, and the girls there made me at ease. Dr. Kirkpatrick walked in and he said, are you nervous? And I said to him, yes. And he said, me too. So we laughed about that. I remember the anesthesiologist putting the medication in my IV. And the next thing I remember, I was waking up. I woke up with no pain. I was drowsy, of course, but little by little the anesthesia went off. Within 4 hours after I woke up, Dr. Kirkpatrick came with my new teeth and he put them on. And I have new teeth since then. It was a wonderful experience. I can eat anything with the new teeth. I'll be able to chew nuts and steak and all kinds of hard stuff that I wasn't able to chew before, that I was just swallowing without digesting. I feel healthier. I don't have as many stomach pains as I used to have, and I feel better. In one day, they were able to do everything that other doctors couldn't do, wouldn't do, or it will take them 2 years to do.
I am personally dedicated to helping people overcome the challenges of periodontal disease, dentures, and missing teeth. At Florida Dental Implants, our team of over 50 specialists are committed to help you get your smile back all in one day.
Before New Teeth Now, when my friends pull out their camera to take a picture that we were going out or anything, I would hide my smile and hide my teeth. I was ashamed of that. But now with the new teeth, I just show them my pearly whites all the time.
So that's a great story. I'm going to go to the next slide, but we do have a couple questions come in, and Bianca, I'm going to let you ask those. But just as a reminder, please, if you have a question, use that little orange, hit the arrow in the orange box, and submit the question, and we will get to it, and I'll answer it live on the webinar tonight. We love doing that. We love hearing your questions and see what's on your mind. But so, Bianca, what's happening?
Yeah, so they asked, what does recovery look like? How many appointments are involved?
Okay, that's a great question.
Two-part
yeah, so the recovery, I'll address that first. So the recovery, typically what I tell patients during the consult is just prepare for anywhere 3 to 7 days. We used to try to really guess, who was going to get swollen, or who was going to have some swelling, who was going to have bruising, who was going to have both, who was going to have none. And it was just really hard. There was no real rhyme or reason, because we used to think that, well, people who were on blood thinners, they're obviously probably going to bleed a little bit more, so they're going to bruise more, they're going to swell more. And we would tell patients that. And then we'd have people in blood thinners that would come back and say, hey, you told me I was going to be all like black and blue and real swollen, and I didn't have anything. And then you'd have somebody, like a young, healthy person that came in and had this done, and they come in, and the first thing they want to do when they come for their first post-op appointment is get their phone out and scroll through and show me like 15 pictures of how progressively they got, like, you're never going to believe how black and blue and swollen I was. And so it's, some people get some bruising, some people get some swelling, some people get both, some people have nothing. So we just tell you to prepare for that, and hopefully you don't get it. The time frame of that is, if you get some swelling, it usually peaks at the second night, third morning, and then it starts going away pretty fast. So usually within that 5 to 7 days, if you did get some bruising and swelling, it's gone or going away dramatically. Pain-wise, I kind of addressed that earlier, but even the people that get black and blue and swollen, they still tell me that, it's pretty routine where, well, I was uncomfortable with the swelling, but I never had like a lot of pain. It was just, I didn't like the swelling. It was uncomfortable. So the pain level still, now that's not everyone. I've had patients tell me that, I don't know who these people are, they're telling you they didn't have pain, because, I did have pain for 3 or 4 days and took all the narcotic. Everyone's different, but for the most part, and the vast majority of our patients, they don't have a lot of pain with this. And there's a lot of good reasons that we know of for that. But the appointments, so obviously there's a consult. Then the next appointment after that would be for where we get impressions, and you meet my restorative team and the lab, where they get those impressions, and you pick out your temporary teeth, what you want them to look like, and then that's what they use to make your set of temporary teeth. I need those in surgery, so that has to be done. Then your next visit is the surgery. And then after that, the post-op appointments, if everything's going as expected, then there's basically 3 post-op appointments with me. I see you about 1 week after surgery to make sure that you're doing okay and there's no infection. I see you about 1 month after surgery, and then I see you 5 months after surgery. If you look good at that 5th month, then I turn you back over to my restorative team, and they can start making your final teeth. I don't let them start making the final teeth. So there's 2 sets of teeth with this procedure. Your temporaries that you get this day of the procedure, and then the final set that we start making at that 5th or 6th month after surgery. We want the implants to be totally healed. We want your gum, your new healthy gum level, to be in its most happy, healthy state and level, because we know after surgery, especially if you've got infection, your gum is going to shrink. Your gum is going to shrink and it's going to tighten up around all those little connectors that we put in, and it's going to get really healthy. We want to wait until that process totally occurs before we build your final teeth, because we want those final teeth to go butt up and touch that gum tissue. We don't want to do that until that whole healing process occurs. Now, with the temporary teeth, they still look really, really good. You can still eat on them. I do put you on a restricted diet until the implants have healed. But you can still go home and eat the night after surgery. We just tell you nothing really hard or real chewy. And then when they make the final teeth, there's typically 3 appointments with that, sometimes 4, depending on how many changes you want to make going from your temporary teeth to the final teeth. And we can talk a lot more about that in a little bit later. But so total appointments, consult, impressions, surgery, 3 post-op visits, and 3 visits for your final teeth, maybe 4. So you're looking at 9 or 10 total appointments over the course of about 7.5 months. And that is for what we're doing and what we're doing. And all those appointments most of them are very quick and easy, the post-op appointments. So you're not here for a long time, but they're needed to, like, I need to see you during those, and a restorative needs to see you to make sure at the end of the day, you go home like Mary, happy and definitely proud of your teeth and your smile. So another part of my practice is facial cosmetics. And, we call that, we kind of coined that New Teeth Now total facial makeover, where literally you can come in and you not only can, change the entire makeup of your mouth with, from an unhealthy mouth to a super healthy mouth with implanted teeth, to chin and cheek implants. I'm talking silicone implants to help, give you more cheek projection. For people who have a really retruded or small chin, and we can bring that out. Brow lifts, raise your eyebrows, eyelid enhancement. People have saggy, droopy excess skin of the upper eyelid. I can help you with that. Facelift, neck lift, liposuction in the neck. A lip lift is a really cool procedure that can be done, especially at the same time as your hybrid. People who have really thin lips, we can actually roll them out, and it's better than getting the fillers placed. And then rhinoplasty, where we address your nose. So a lot of these procedures can be done at the same time. So you literally can come in and walk out as a new person. Some examples. This is a CO2 laser resurfacing of the skin. She came in to talk about her teeth. She wasn't happy with her teeth. She was told she needed dentures. She didn't want dentures. She wanted implants. So when she was here, she found out that I also did the cosmetics, and she was asking what she could do about some fine lines and wrinkles in general on her face, as well as all the dark sunspots. That's one of the things that we have living in Florida here. We got the sun. They cause these dark spots. So we did her teeth, her implants, her new teeth, and a CO2 laser resurfacing the same day. This is about 2 weeks after. And you can see, the after picture looks like the before picture's younger sister. Just a big, did it get rid of everything? No. But did it improve her? Dramatically. Fine lines and wrinkles, almost all of the sunspots are gone. Look at the difference here versus here. It's like orange peel versus kind of smooth skin along the forehead. All of those little sunspots are pretty much, they vanished. A face and neck lift. If you look at the jawline here, and the neck, kind of got that sagginess here, tight, nice jawline. Another brow lift, face lift, upper eyelids, neck lift, and liposuction. Big, big difference between all this is gone. She's got that sharp neckline now, nice jowls, Eyebrows are in a great position. Silicone chin implant. You can see here, very retruded chin. She's even trying to strain her mentalis muscle. That's why you see these little dimpling effect there to try to get her lips to close. Now she can be super relaxed, nice projection of her chin. She can easily get her lips to close, even though she's not there. So with dental implants, people ask me this question a lot. Am I ever going to have to need a root canal on my implant? Am I ever going to have a cavity or a crown? Well, no, dental implants, they're fake. They will never need a root canal. They're never going to decay. And what a nice before and after picture. And they're super easy to maintain. Toothbrush, toothpaste, and I love for patients to use a water pick to kind of water floss underneath them, but you brush them. Like I do my natural teeth, toothbrush, toothpaste, and you go every 6 months to your general dentist, have them professionally cleaned. Anything that is in your mouth that you can't take out and wash under a sink like you can a denture or a partial, you have to get professionally cleaned. The design of your salivary glands, your spit glands, where they empty mixed with food, drinks, sugar, they will form plaque and calculus, and it'll build up on your bridges around the implants. If you don't get them professionally cleaned, it's going to sit there and your gums will get irritated again. So you still have to take care for them. So before and after, I love this picture of Donna. She's a patient that, our office got to know really well, but just a dramatic difference in her before and after picture. I love that picture of her. So the all under one roof. This is something that we are very proud of here at our office. I was trying to think of the right words because we hear it a lot where people are coming in and they tell me like, well, I went to see a general dentist. He sent me to another office where the oral surgeon was. The oral surgeon saw me, and then he sent me back to the general dentist. Then the general dentist sent me to the lab so they could make sure that the color was correct of the teeth. And then I went back to the oral surgeon from the post-ops and went back to the general dentist office, the restorative dentist, to have my teeth made. We have everything here, everything under one roof. You come here for the consult. You come here for your impressions and the restorative appointment. You come here for your surgery. You come here, the lab is in-house. Your teeth are made in our office. I mean, they're actually made from scratch in our office, which is huge advantage for our patients because the quality control, we're in control of that. And then the final teeth are made here. They're actually milled through digitally by a computer and a milling machine in our office. And then the artist in the lab make them look the way you want them. The procedure, all in one day. So you come in as you are, whatever the situation that you present in, whether it's no teeth, a mouthful of teeth, mouthful of periodontal disease, you come in, the procedure is done in one day. If you have teeth, they're taken out. If you don't have teeth, we go ahead and start placing the implants. But if you have teeth, we take the teeth out, then go ahead and start placing the implants. But it's all in one day. You come in and you have procedure done, your temporary teeth placed that day, and then you go home. Come back, like I said, 5 to 6 months later, and that's when you start getting your final teeth fabricated and made. The temporary teeth are made out of acrylic. It's a really high quality acrylic, but the reason that we do that is that it's very easy for our lab to get those to fit you the same day, and it's very easy for us to adjust through that healing process. So when we put them in, if you'd say, oh, it feels like I'm biting down too hard on the right side, I can easily adjust that in your mouth. Then when it comes time for the finals, the zirconia is a totally different material. It's the strongest, most cosmetic material that we have to make these teeth out of. And we want to try to give you something that is going to, if you take care of it, that the maintenance is going to be low and they should last you the rest of your life if you take care of them. The consult is about an hour appointment. And it consists of, we obtain an ICAT, which is a CAT scan, and then we use that to develop a treatment plan. And you actually sit with me and look at the CAT scan together with me, so you know what I'm looking at and you know what I'm going to do. So we had another question or two come in, so I'll stop at this slide on Shauna in the blue shirt, Debbie in the black blazer. There are two implant coordinators. Both of these ladies are phenomenal. They have been doing this for a really long time. They're very informative. Patients love sitting and chatting with them because they can kind of walk you through the whole process. And usually when I walk into the room, I'm just there to say, yeah, we can do this. You've got enough bone, because Debbie and Sean has already informed you of everything else. But hey, Bianca, what's happening?
All right, so this person says, can out-of-state people get this done?
Absolutely. So we have a lot of patients. The one patient with the Zygomatic implants that I was talking about that flew in from the Northeast, that's common. We've had a patient, actually, we were talking about this about a month ago, where we track everything, and we've had a patient from every state except North Dakota. So if anybody on here from North Dakota is looking for implants, I'm your guy. Come in. We need to talk, because we want somebody from every state. But yeah, definitely, there's a lot of things that we do to help facilitate that, from helping you with the travel, trying to coordinate that. There's a couple of nice hotels that are really close to the office. And then for out-of-state patients, we know that kind of, time of you getting down here, there's a lot of things that we can do to not rush it, but where we can do, you're here a little longer, but we can put you kind of on a fast track for, like, to do, for example, if we know you're coming from New York, we can set it up to where we can do your consult and have time set aside to where we can do the impressions and the pre-op and everything the same day. So things like that we do for the out-of-state patients to try to make it easier. But most certainly, and we have patients that come from, I've got a couple of patients from Alaska. We have people from all over Europe that come to get this, because there's not a lot of people that are trained, unfortunately, in the Zygomatic implants, or that do a lot of this. And especially, there's very few that have everything in one place. And patients learn to, if you're a patient listening to this, if you've explored this or gone for opinions, you know what I'm talking about. Or maybe you didn't even know that you knew what I'm talking about, because, if you know you're going to be bounced around to different offices, and you see how important it is to have everything at one, that's why we get a lot of people coming from out of state and a lot of people coming from out of the country. And then there's another question.
Yes. Okay, so there's two more. So they're coming in.
Perfect.
So can I choose the shape and size of the final teeth? That's the next one.
Yes, you can choose the shape and size of your temporary teeth. You can choose the shape and size of your final teeth, and they do not have to be the same. That's one of the, so our implant coordinators kind of tell patients, think of your temporary teeth as like your test drive set. So there's not a whole lot of stress, because people were kind of getting freaked out about, oh my gosh, I don't know, what color do I want to pick? Because I'm going to be stuck with these for the rest of my life. And, you pick what you think you want for your temporaries, and you wear them for 6 months. If you want to go wider teeth or bigger teeth or smaller teeth or darker teeth, then you can make that change going from your temporaries to your finals. And the cool thing about that is most of the time they do what's called a wax try-in, especially if there's a lot of changes you want to make, where you've been wearing your temporaries, you know what changes, or you think you know what changes you want. So you talk to the restorative team in the lab. They make your final set out of wax. They try those in. You look at them, you feel of them. If it's what you want, they take them out, they take them back, they scan them, they make your zirconia. If it's not what you want, maybe you come back for another wax try-in, because we want you to be sure that when that zirconia is made, that's what you want and you love them.
Okay, perfect. And then the very last one so far
Okay.
is there anything you can't eat in the finals?
Not that I know of. So you should be able to eat. I mean, not that I know everyone's diet, but I mean, you can eat steak, you can eat nuts, you can eat pretty much anything. I wouldn't go chew on, things that, so the way I look at these final teeth, zirconia is probably stronger than your natural teeth. But saying that, I tell patients my recommendation is you need to do what I do with my natural teeth. There's things that I can eat that I shouldn't. Ice. I used to be a person who would definitely, if I had a drink with some ice in it, I would, take a drink and get a couple ice cubes in and just start chomping down on them. Well, ice can damage your natural teeth. Ice can probably over time, it may chip the zirconia. We don't really know. So right now, if the zirconia is stronger, it's not showing wear and tear like that. But that's what I tell patients. If you shouldn't eat it with your natural teeth, then you probably shouldn't eat it with your zirconia teeth. Jawbreaker candy, so candy like that, you shouldn't just, you need to suck on it, get it softer and then chew it. You shouldn't just bite down into like a really, really hard piece of candy because it probably could chip the zirconia. So just, it's kind of just more common sense that for food wise, you can eat pretty much anything you want. Any other questions, Bianca?
No, we're good for now.
Okay, we'll keep them coming. So, a restorative team. This is Dr. Nafala and Dr. Dibbs. Both of these guys are really good at what they do. They've been doing this for a long time, and it's very cool to have for me to be one of their teammates and give. I look at myself as like, if you're thinking about construction, I'm the foundation guy. I pour the foundation and give them a foundation to build your teeth, build the house on. They build it, and the lab helps them make it look really good. So it takes a true team effort to, from start to finish. Oh, let me back up. So Dr. Dibbs, he's going to kind of walk you through his perspective, which is very nice to hear, just from the restorative aspect of what he does and how he helps the patients. So you'll kind of get a feel of what you would encounter when you come for the restorative portion.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. And we need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable. Not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Well, there you go. I think it's cool to hear Dr. Dibb's perspective on this and how important he thinks it is to have, have the lab and the surgeons and everybody kind of under one roof, because it's fairly common too for him to come down and ask me a question about, hey, can you run up and look at this? Like, just before I proceed, patient had a question about a spot on the gums, or so we're constantly just making sure that everything looks good, everything's going well, so the patients don't have any problems. This is, my surgical staff, and it's one thing when you come here that you'll get to know us, not just as, and I think that's important, where you'll come, you're not going to see me for the consult and see another surgeon for the surgery, and then me for a post-op and somebody else for a post-op. You come here, if you see me for a consult, like, you're mine. I'm going to be doing your surgery, I'll be doing your post-ops, and I do work with the restorative team, and you'll be with one of them. You'll either be with Dr. Nafala or with Dr. Dibbs or with one of our restorative teams, but you get to know me, you get to know my surgical staff and the assistants, and I think that's cool too, because it definitely has that. It's a very big office with that small town feel, and that's the way we want to keep it. So our anesthesia team, these are our two main anesthetists, and they're both very experienced. They've been doing this for, you can see this, and that was a few years ago that this picture was taken of Jack and Kim, but he'd been doing it for both of them over 30 years at this point, and they're excellent at what they do. They're very compassionate, they're very good, it's safe, and they do their due diligence of helping us work up patients before to make sure that the anesthesia portion in the surgery does go well and it is safe. We got a great track record, and we want to keep it that way. And then here is this is the front of the building, and pretty much the entire team. And it takes everybody that you see here to help, get you from point A to point B. It is definitely a team effort. And Bianca, we have another question.
Yes. So this person, it was a follow-up to the final teeth, but does candy or gum stick to the final teeth?
Well, it depends on what kind of candy or gum you're using. But if candy or gum sticks to your natural teeth, then it will stick to these teeth. But typical, chewing gum, no, it's just, you treat them just like natural teeth. If you have a piece of caramel, or what's the one that was on, like a sugar daddy sucker, that stuff sticks to everything. So yes, that would stick. But a regular, like Snickers candy bar, regular juicy fruit, or some type of extra chewing gum, no, it's not going to just stick to the teeth. They literally, you treat them once you get into your finals the same as you would with your natural teeth. Any other questions yet?
No.
Okay. So thank you guys for being on here and joining us on a Tuesday night to talk about implants. I hope it was informative. We try to, try to get through it and not keep you all night, but we do want to get the information to you. If it's something you're considering, please call and come in for a consult. I'd love to see you and talk about how we could potentially help you. Thank you guys for being on here.
Thank you guys. Have a good night.